Even from the time of conceiving to the time when the mama goes to the labor, there is a period. So you can't ask the benefits tariff and advisory committee when you will see the benefits. You allow them first to go and sit, and they will tell us, today is their first day. Go put that on the online. I have not heard about online, but put it there. Anything else? That's okay, thank you very much. But on the cartels, of course I don't address cartels through the media. But if you know some, you tell me. Don't go away.
ETV Africa News at this hour.
Together with all the attendant regulations that we have passed, we want to thank Parliament, empowers the Cabinet Secretary to establish a benefits package and tariff advisory panel. And accordingly, in full compliance with the law, I've appointed and officially gazetted the benefits package and tariffs advisory panel through Gazette Notice number 5044 of 23rd April of 2025. And this morning, I have the pleasure to officially inaugurate this panel, which comprises of very distinguished professionals drawn from a wide range of disciplines. This panel is tasked with a very critical role from where I sit. And your functions and your mandate is cut out. You are to provide us with the expert advice on the design and the review of benefit package and tariffs under our Social Health Authority, under our Social Health Insurance Framework. The benefits and package and tariff must be evidence-based. It must reflect equity. It must be financially sustainable. And again, it must align with our national health priorities. As stipulated by the Social Health Insurance Act and its regulations, this panel will do the following. Number one, it will recommend the design, the review, and the updating of benefits package through health technology assessment process. Number two, this panel will review and update tariffs to ensure cost effectiveness and its affordability. Number three, this panel will help us to identify essential health interventions that are currently unavailable in Kenya, but should be of priority. And number four, this panel will help us assess disease burden among our citizens, the needs, the population health needs of our people, and access to service to guide policy decisions. It will also help us engage stakeholders, including healthcare providers and the public, so that we get what I can call inclusive policy making. And lastly, you will help us support evidence in order to aid the Ministry of Health and the Social Health Authority in structuring the packages, the benefit package and tariffs. This panel will be hosted at the University of Nairobi College of Health Sciences, selected through a very competitive process, and it's expected to convene at least twice annually to undertake its mandate. This initiative marks a significant step in strengthening the partnership across government, academia, the private sector, the civil society, and such collaborations will ensure that there is the element of transparency, accountability, and broader stakeholder input. Crucial ingredients for achieving affordable, high-quality healthcare for all Kenyans under the principle of leaving no one behind. The implementation of the social health insurance since its rollout on 1st of October has not been without challenges. And I urge the panel to urgently address the following priority areas. Number one is inadequate data. There is limited information on disease burden, population needs, service costing, system capacities, and healthcare outcomes. As a country, we are also faced with a high cost of services. So we need you to help us, especially in managing mental health, spinal injuries, cancer, chronic diseases including CKD, and any other rare conditions. We also lack price regulations. The current free market model lacks price controls for health services and products. And one of the things we're going to deal with as a government under the UHC is to deal with the cost of commodities and products. It'll also help us unbundle tariff. This aggregating cost for consultation, diagnostics, and pharmaceutical complicates our reimbursement models. And while you unbundle the tariffs, this may not guarantee value for patients or the fund. So we want to have a harmonized tariff on what healthcare workers, both in public and private, should charge for consultation, for diagnostics, for pharmaceuticals. We can't have one person charging you consultation 10,000, another charging you 5,000, another charging you 2,000. I mean, this is, and I can give examples of my own doctors. You know, one used to charge me 10,000. The current one that was my doctor was charging me 4,000. The last time I visited, he charged me 6,000. And on one time, you know, my late mom was in Nairobi hospital, and I asked one doctor, this bill you're giving me, and you just used to come and greet my mom. Are you charging me for the greeting? So that's why I'm telling you, we must have, like the developed world, we must have there, and I think it happens in other professions. I mean, we know how much an architect will charge you when he designs for you. We know how much an engineer will charge you. And even lawyers, the prices. So that's why I'm asking. I mean, doctors are good people and great people, and they save lives, but we must bring some order to the health. And that's why the benefits and the tariffs is something new in our country, and it will help us. I want you to look at the vertical program integration, progressive inclusion of donor-supported programs into the national benefit package. I want you to look at the outpatient and the inpatient service modeling in our country, especially at the primary, secondary, and tertiary levels, including simulation of provider payments mechanism. Sustainability, you need to look at it, of the fund, developing a very robust plan to ensure that there is long-term implementation and viability of the benefits and tariffs. To enhance the effectiveness of our social health insurance system, we must adopt a data-driven decision-making, and we must prioritize cost-effective intervention. We must strengthen our public-private partnership, and above all, we must leverage on digital solutions to improve service delivery and policy evaluation. A comprehensive needs assessment is also necessary, to evaluate both the technical and the financial capacity to carry out health technology assessments. Capacity building for the panel and the ministry staff will be essential in this regard. In conclusion, building a strong and sustainable health system is not just a moral obligation. It is a strategic investment in Kenya's human capital, strategic investment in the productivity and the economic development of our nation. A healthier population is the foundation of a more prosperous nation. Therefore, call upon all stakeholders, SHA, policymakers, academia, the health professionals, civil society, KEMS and county governments, and the public, our good citizens, to actively support this panel's work. Let us ensure that the benefits and tariffs we develop are inclusive, they are data informed, they are cost effective, and they are sustainable. Mr. Chairman, rest assured that the Ministry of Health stands ready to work closely with the University of Nairobi to realize our shared vision of a healthier, stronger, and more prosperous Kenya. Thank you very much. And it's now my opportunity that now you have a work to do, a very important work. One of the key elements